Assalamualaikum and hi. My name is Nur Fatihah binti Johar and this is
Afika binti Sapawi.
Alisha Nabila binti Muhammad Noor.
we are students from
Bachelor of Science in Equine Management.
So today, we would like to show you guys about general nursing care. The factors need to be considered when nursing a horse are: first, stabling; second, measure to nurse a horse; third, food, water and medication;
Fourth, veterinary bandaging. Fifth, treatment of wounds and injuries. Sixth, when to call the vet. 7. How to wrap an injured hoof.
Let us start with stabling. The stable for sick horses should be warm and dry and have adequate drainage. Stables should also be clean to reduce fly problem and to keep the horse in a more pleasing environment. Moreover, the wounds and dressing are also likely to stay cleaner. The horse should be monitored several times a day and keep a written record about their overall condition. As for the bedding, complete marking out system should be carried out daily. Feces and urine soaked bedding should be removed every time marking out. The bedding should be thick enough to provide cushioning underfoot. For horses that have respiratory problems, use paper bedding or shade. Next, the stable should have adequate ventilation with plenty of fresh air throughout and no drought and dust. We should use extra lightweight blankets to keep horse warm, particularly during colder months. Furthermore, horses that have contagious disease such as cough, runny nose, strangles, and diarrhea should be isolated to prevent transmission of disease. The period of isolation depends on the disease involved. Isolation box should be at least 35 meters away from the other horses. Bedding stores, feed or tag room. Use separate set of feeding utensils, tag, and grooming tools. Next, equine disease can be spread in various ways, including direct contact between horses, contact with feces, contact with insect or animal vectors, and also contact with contaminated needle. The best defense against any infectious disease is to provide regular vaccination, good nutrition, adequate exercise, and a pleasant environment. Remove and burn all bedding, hay, and salt lick. Lastly, disinfect all equipment that have been used by infected horse.
second, measure to nurse a horse. Nursing a horse means that a practice of providing care and comfort for sick, lame, or injured horses. When nursing a horses, use rugs to keep warm. If the horse is feverish or sweaty, use anti-sweat rug under the other clothing next to skin. Will help air to circulate. Also, specific rugs and hoods can be used to control sweat, itch, and protection from flies. Next, when applying bandage, use plenty of cotton pads to help control swelling. Stable bandage on all 4 legs to keep horse warm. But if the horse tends to tear bandage and dressings, apply anti-chewing paste to prevent it. When exercising or turning out a horse, always follow vet advice because lameness will get worse if horse started to canter or gallop during exercise. It is advisable to turn horse out after exercise when he is hungry. Also, increase the time a horse stay out gradually.
The third one is food, water, and medications. For sick horses that have respiratory problems, it is best soak the hay or give vacuum-packed semi-wild grass. Fresh grass to horse that can be let out of race, but only in small quantity. For resting horse, they do not need much concentrate food because it may induce more problem if the horse is overfed. In order to prevent constipation, give regular fed, mainly of raw fish, and access to fresh water. And for the water, all horses need fresh supplies of water, so we should change the water at least once a day and make sure the bucket are clean. For medications, medication can be given by mouth or by injections. Powder or syrup can be given in the foot. So if we're using powder, it is advisable to moisten the foot a little so that the powder sticks to it. If the horse refuses medicated food, make a paste of the powder with honey or dissolve it into the water and then administer it to the tongue with a syringe. Tablet can be given in a piece of carrot and also apple, or they may also be crushed and mix it to make a paste. It is advisable to not mix the medicine with water because it is difficult to check if the horse is actually taking the medicines, to prevent the horse from not drinking water.
For veterinary bandaging, there are several uses of bandage. Bandage is applied to help in prevent of foul flesh. It is also help to reduce soft tissue swelling. Next, it also aids in protection of wounds. Bandages also prevent development of a peeled leg. Also, helps to keep poultice in place. And lastly, hold a cold pack in place. Points to remember when bandaging. Apply a bandage with even pressure and a 50% overlap and do not overstretch the bandage. Never bandage the horse's leg without padding. Use veterinary gamgee. Use figure 8 bandage for knee and hock injuries. Always bandage the opposite leg to provide support. Alright, fifth, treatment of wounds and injuries. Poulticing. There are two types of poultice, which are hot poultice and cold poultice. Hot poultice give moist heat to an area and also helps in softening hard hoof horn. Cold poultice is used on bruised area to reduce swelling. Poulticing consists of impregnated cotton wool protected by gauze and a tin of plastic which is placed over it. It is to maintain moisture and heat or cooling effect of cold poultice. Next, we will move on the ways to use poultice.
First, we'll go over the equipment that you're going to need. You want a rubber glove to try and keep some of that clay poultice from getting into your skin. You want a clay poultice product such as Soar No More. It comes in a little container like this, and you might have to add water periodically as it starts to dry out. You'll want a paper bag, poultice paper, or shop towels that you'll be able to soak and get wet to wrap around the poultice. A bucket of water for dipping that, and then your standard stable wrap again. We're going to start by taking our clay poultice out of the dish with our glove and rubbing it up and down the leg between 1/8 and 1/4 inch thick across the back of the tendon. You'll do this all the way around the leg on the inside and the outside. Now to cover the poultice, you can take off your glove again. Next, take your poultice paper and you're going to dip it in the water, soaking the entire paper. When your paper is wet, you can wring it out a little bit so it's not dripping. And then wrap it around the leg, just applying it over the top of the poultice, making sure you cover all of the clay so that you don't get it on your stable wrap. Push it in and conform it to the leg so that it's going to help keep the poultice nice and moist overnight or whenever you're leaving it on. That'll hold itself in place while you grab your stable wrap supplies. We're going to take our pillow wrap, and I'll link this also to our stable wrapping video if you haven't done that before, but I'll quickly demonstrate it again. Done with the poultice. You can leave it on overnight or just for a few hours, whatever's convenient and is going to give the most effect for your horse. When you're done, you can pull your stable wrap and the paper off and either leave it to dry and curry it off or brush it off, or you can use a hose to also try and wipe the poultice off.
Next, for treatment of wounds and injuries, hosing. There are several functions of hosing. First, to clean the wound. Second, provide cold and massage therapy. Third, reduce inflammation and soft tissue swelling. Fourth, to relieve pain. Area that we need to be hosed is approximately 15 minutes, then are allowed to reheat. Repeat the treatment up to 3 times in a single session. Start by trickling water slowly over foot. Gradually increase water pressure to steady flow. Move the hose up the leg to the damaged area. Dry bag or fasten carefully to prevent cracked heels.
The number 6 is when we need to call the vet. Okay, so we should ask the veterinarian for an advice. For special therapy need to be done. So there are some complementary therapies, such as the first one is laser therapy, which is it reduces inflammations and speed up wound healing if applied correctly. The number 2 is ultrasound therapy, because it reduces inflammation in muscles and tendons. So it also helps in relieving tenderness, muscle tensions and swelling. The third one is physiotherapy, osteopathy and chiropractics. The number 7 is how to wrap an injured hoof. For the last part is we will show to you guys how to wrap an injured hoof.
Hi, I'm Danvers. I'm the hoof health consultant here at SmartPack. Today we're going to talk about wrapping hooves. One of the things that you'll want to do is to choose all your materials and get them handy so that you don't have to drop it and go look for something. What I'm using now is an animal Lintex poultice. This would be one of the products that you might choose for packing a foot that had some sort of infection or abscess that you wanted to make sure was drawn out. This particular pad is cut to hoof size, and in this case I'm cutting it down smaller to make sure that we have it to fit this foot. I like to use an elasticon and come around the foot with the elasticon first, especially if I'm going to wet the material or use a wet material. If I get this on first, I'm not going to have to fight with it at a later point. So take my packing material and insert it. That elasticon will hold that in, and then I can come over the top of that with my duct tape pad that I've already got established. At that point, I can make another wrap with the elasticon, or I can go straight to the duct tape depending on the conditions. In this case, we're going to go straight to the duct tape, and I'm going to come around, make 2 passes, ensuring that I stay off of the sensitive areas of the hoof. I've stayed away from the bulbs, away from the hairline. Got the little tag here that I'll go ahead and cut off. I don't think it would get into the hairline, but we'll make sure that it doesn't. At this point, I've got a functional wrap, and I can reinforce it as need be. But when you're using duct tape, I find that horses will tend to paw, and I like to reinforce that toe with at least one more overlap. Simple, basic, effective.
That's all from us. Thank you for watching our video.
And don't forget to like, share and subscribe to our video.
We hope you enjoy it. Have a nice day.
Bye!